Does birth control affect fertility? If you're wondering whether your fertility has been affected by taking birth control pills or using other birth control methods, keep watching. Hi there, welcome to Elizabeth Mucci's channel. Elizabeth is a natural fertility specialist and founder of the integrative health clinic Life on the Inside. On her YouTube channel, you'll find videos to help you learn more about female and male reproductive health and common problems that could be getting in the way of you starting or growing your family. When it comes to using hormonal birth control, such as a pill, patch, ring, hormonal IUD, implanted rod, or injection, your fertility can temporarily be affected for a few weeks, a few months, or in some more rare cases, a few years after you stop using it. However, in most cases, using these forms of birth control shouldn't permanently impact a person's ability to conceive. Most hormonal birth controls work by preventing ovulation, which is the release of an egg from the ovary. Without ovulation, there's no egg for sperm to fertilize, which means pregnancies can't occur. Other forms of birth control, such as the copper intrauterine device, or IUD, doesn't affect ovulation and instead works by preventing fertilization or implantation of a fertilized egg in the uterus. When a person stops using a copper IUD, their fertility should return immediately. In the case of hormonal birth control, a person's fertility should return within a few months, as their body returns to its natural hormonal balance and ovulation resumes. Having said this is assuming that a person was not on hormonal birth control to help treat an underlying medical condition that is also having an impact on their reproductive health and fertility. For instance, endometriosis is a condition that can cause infertility, and hormonal birth control is a method that can be used for managing endometriosis symptoms. These methods work by regulating the menstrual cycle and reducing the growth of endometrial tissue outside the uterus. The birth control pill can also reduce the amount of estrogen that is produced, which can help to reduce the size of endometrial growths. And even in the cases where birth control has not been used to help treat an underlying condition or regulate your menstrual cycle, there are other factors that can prevent your body from becoming fertile and increase your chances of chromosomal defects and miscarriage. Not only is it important to consider your age, underlying medical conditions and infections, it's also key to consider lifestyle factors like obesity, diet, smoking, and drug use. If you've recently ceased hormonal birth control in the hope of conceiving naturally, it's important to understand the complete picture of your fertility with a thorough investigation and an integrative reproductive health plan. If you're trying to fall pregnant and would like to learn more about the steps you need to take to bring a happy, healthy baby into the world, be sure to subscribe to Elizabeth's YouTube channel and check out the description below for a link to her free 10-minute fertility webinar, or visit www.lifeontheinside.com.au.